OAF also believes so much in social entrepreneurship. That is why we came up with the 256 Startup Program, which looks at the mothers that are venturing into social, social work, something that brings them food on the table. We know that many of them are actually breadwinners at their homes. So we came up with the 256 Startup Program, which is a social entrepreneurship to uplift them, to train them, give them financial literacy, give them a chance to network with others, and also give them guidance on how they can add value to the products that they are currently engaged in. This project started last year. However, because of the COVID pandemic, we were totally shut down with many obstacles, but the 256 Startup Program is still here and up and running, and we think that the mothers, the young mothers, the women especially, and the people with disabilities will benefit so much from this. This is our focal point and our focal area in the social entrepreneurship.
The 256 Startup Project is a social entrepreneurship project that looks at empowering young women with entrepreneurial skills. Young women have always been marginalized and left behind in so many ways. But when it comes to entrepreneurship, we know that when a woman works, she will employ a woman. So in our efforts, to streamline the aspect of gender equality, we wanted to change the lives and impact the lives of young women by supporting them with entrepreneurship education, financial literacy, and then some startup capital so that they can run their own businesses on their own as women and employ their own as the female gender. I think as the project itself, 256.
Yes, Uganda is one of the most entrepreneurial countries in the world and in Africa. However, most businesses don't even last their third birthday. This is majorly because we lack financial literacy skills, and also funding is very low for young, especially the young females. So we came up with 256 Startup Project. This project is targeting the girl child, the mothers and the women. We want to skill the girl child, we want to skill the mothers, and we want to skill the women with financial literacy skills, plus also access them to funding for their startups, some boosts to give them a chance to do business, and also have some equality when it comes to their gender, so that they can also be able to live a lifestyle just like the men in the communities. Women can change the world, and we believe if we skill them, we have skilled the nation. Thank you.
Juzza Lorry is one of the biggest campaigns that Outcast Activists Forum run annually. We began last year, whereby we had the opportunity to dedicate the edition to the people of Vempi. This is a refugee camp that is in Terego district. So the main idea on this campaign is how we can help them cope up with the challenges in the COVID time. This came as an idea that we could help and collect a lot of items, basically the basic ones that they need, that they lack. Definitely they will be needing, but when they do not have access to. So some of these services is what we're trying to extend to not just them anymore, because this year has brought many more ideas which is being run right now. The idea is to the maternal and child health, and this time around we think that we would cross over and make sure that the general public gets to benefit by being a part of this kind of a campaign.
Juzza Lorry is a Uganda word that means fill the lorry. The rationale of this whole project is to embrace generosity, to embrace the spirit of giving in different kinds of ways. And Juzza Lorry, the lorry itself is a symbol of generosity and giving within the African culture. We try to look at those that are very marginalized, those that are living in what we call unserved or underserved communities. For a long time, even before the pandemic came, we know society has been facing so many challenges.
Juzza Lorry, what an amazing initiative we are doing for Uganda. We are filling the lorry, and we are also taking health workers from urban areas and giving these services to people in remote areas. Last year, with Juzza Lorry, we were focusing on the refugees in Uganda camp. Uganda has the biggest refugees in the whole of the world, and as per now, we are doing our second edition. This second edition is for the mothers and the children in Buswobi Health Center in Uganda. We're looking forward to supplying them with maternal health care equipment and also services for them. We thank you very much.
In the wake of COVID-19 second wave here in the country, Uganda, we had a lot of challenges with the people that we work with in the remote communities, the slum of Kampala, the people that we normally try to, extend our services to. So we came up with COVID-19 resilience and response, whereby it looks at attributing to a pack, what we call a care pack. This care pack, we also put in the aspect of basic needs, and our focus is on the young mothers and also the ones that do not have their husbands. We also look at the ones that are, we call them the PWDs, people with disabilities. So basically, the CRR is also one of the biggest campaigns that we run. It's of course a charity that goes to the mothers in the slums, and then we try to give them hope of continuing in the time of the hard times of COVID-19. And here we also try to give them the support of the basic needs like soap and all that.
COVID-19 Response and Resilience Project, the one you can refer to as CRR, is a community-based and community-driven project. Our focus was to identify single mothers, single-headed households in the poor slums of Kampala, urban slums of Kampala in Uganda. These women that have been very, very much affected by the COVID-19 pandemic and its effects. It has created a lot of unemployment, and people no longer work, so it is easier for people to sleep hungry and for children to sleep hungry. So we wanted to support these mothers with.
COVID-19 has affected every aspect of our lives. However, it has affected the communities much, much, much more. We have mothers, single mothers, who are going through a lot because they don't have work, because COVID-19 has left them unemployed. So we came up with a solution. It's called COVID Response Program, CRR. And this program is meant to give care packages that are just basic needs for the mothers, the single mothers in slums, single mothers in remote areas, to take care of their children. We thank you, and we look forward to your support.